My name is Dr. Amandua Jacinto. I'm representing the Minister of Health of Uganda, and we have also some delegates from Uganda. In the interest of time, I have been given 5 minutes, and I've been told to summarize my presentation verbally, but the PowerPoint presentation is available. Chairperson, Uganda, like any other African country, has a very high prevalence of hepatitis B, which runs at 10% of the population, and this varies from about 3% to 23% in various parts of the place. We also have hepatitis C among blood donors. The prevalence is at about 2.5%, and we have had epidemics of hepatitis E in various parts of the country. Chairperson, Uganda introduced hepatitis B vaccination for infants in the year 2002, and now with the population between 1 year and 14 years, they are covered with the immunization against hepatitis B through the pentavalent vaccine. But we have got a big problem of the population which is above 14 years, and surveys which have been done in Uganda indicated that this population is at a very big risk. And also, we have not introduced the birth dose of hepatitis B vaccine. Chairperson, our policy has been informed by the WHO resolution of 2014, which obliges member states to take certain actions to reduce hepatitis from being a public health program. So we have adopted the WHO resolution, and the Minister of Health is implementing it as the WHO has considered. By the time we come to report, we have what the steps which we have taken. Chairperson, I'd like to briefly summarize what we have done to implement the WHO resolution which was passed last year. At the level of policy, the Cabinet of Uganda and the Government of Uganda has declared hepatitis B a disease of public health significance, and to that effect, the Minister has signed an instrument which obliges everybody to take hepatitis B as a public health problem. This is a landmark obligation for us, because for the first time, the government will now be able to put the resources. The Minister has also passed an instrument which makes it compulsory for all health workers to be vaccinated, and as we talk now, if the health worker is not vaccinated, employment in the health sector will not be permitted. The same law also allows all students in training institutions to be vaccinated compulsorily on the entrance. The second national policy objective is on the prevention and also on mitigating the impacts of hepatitis B. To this effect, Chairperson, the government has put a strategy and action plan where those who are eligible, those who are at risk, and the general population will access free hepatitis B vaccination, especially for those who are above 14 years. The government of Uganda has this year allocated about $3 million for the procurement of vaccines, injection materials, and other things needed for vaccination. The second obligation which the government has done is to work with the civil society, with the other aspects, with the academic institutions, and also with the research institutions for the prevention, diagnosis, and treatment of viral hepatitis. We have a technical working group which comprises everybody from the Ministry of Health, from the Ministry of Education, Ministry of Gender and Public Service, and also the civil society organizations are present on the committee, and the research institutions and the universities. This committee oversees the implementation of the hepatitis program in the country, including the policy formulation, preventive services, care and support, logistics, human resource, infrastructure, and also availability of medicines, laboratory reagents, as stipulated in the WHO guideline. We also include the Among the other things we are doing is to strengthen blood safety in the country. Blood safety was one of our first interventions for the control of HIV, but now with the coming of intensifying strategies for hepatitis B, we are going to strengthen the safety of blood by testing for all the blood-borne pathogens, and also by having the safety of blood. We have got treatment for those who are affected for hepatitis B. I would like to inform this House that in Uganda, government has allocated funds for the procurement and for antivirals for those who need it. This year, we are targeting about 350 people to access the treatment. We have started 2 pilot clinics in the national and 1 regional hospital. We are going to strengthen this in all the national referral hospitals. And also in Uganda, one of our factories, that is Sipula, is able to manufacture the tenofovir and entecavir locally, so we'll be buying from them. So the issue of access is, we think there's not going to be a big problem, because the factory which we have is WHO pre-qualified and is already manufacturing ARVs for the whole region of East Africa. So this factory has already taken on the manufacture of medicines for hepatitis B, especially first line and the second line, and in the future, if need be, it will also manufacture from hepatitis C, and we think that it can supply the whole of the East African region if need be. We have also taken measures to strengthen prevention of hepatitis E, which occurs periodically in certain parts of the country, and already measures are in place to ensure that there is safety of water and the promotion of hygiene. Among other things, Chairperson, which we are doing, strengthening of the infection control. We are one of the pilot countries which is under the WHO injection safety program, and we are already going to strengthen the infection control practices, and also introducing the syringes with the reuse prevention when WHO makes them available. There are other elements which we are also considering, which have been considered, especially access to new medicines. As I told you, we can be able to manufacture our medicines local for now, and in the future, if it need be, we will be able to work with the other people. There are other areas which we have included in the policy of hepatitis. This includes healthcare waste management, injection safety and prevention, and also consideration of the introduction of the birth dose for hepatitis B vaccination, which hopefully we'll be doing in the coming years. With all that, our political support has been very, very big. The President himself was the one who launched our hepatitis vaccination program, and already the other partners are working with the WHO, CDC, and also the academic institutions. We hope that in the coming years, there will be strengthening of the vaccination program, there will be access to treatment, and there will also be strengthening of preventive services like infection control, healthcare waste management, and there will be adequate care of those who are affected and those who also have complications like cancer of the liver or cirrhosis, including palliative care. Thank you very much.